Well, Ashley, thank you so much for coming on to the You're Not Alone podcast today and giving myself and my audience a little bit of your time. You have what seems to be a very interesting story. So that's really where I want to start this podcast today. Can you give my audience an introduction on yourself, and then can we start at the beginning for your journey and kind of go from there? Does that work?
Sure, absolutely. And yeah, thanks so much for having me here. I love what you're doing. It's really exciting for me to be here. So I am a licensed clinical professional counselor as well as a board certified dance movement therapist. So I have training as both a talk therapist as well as a dance movement therapist. And I know we're going to go into a little bit more about what dance movement therapy is in a bit. A lot of my experience has been working with folks who've experienced very severe trauma, so refugees, immigrants, other survivors of trauma. And then within the past 4 years, I've moved into working with folks that have OCD.
That's awesome.
And I think a lot of that does stem from my own story, which I'm happy to share. And I know this is really one of the first times that I'm sharing pretty publicly. I know on some websites where I'm listed as a therapist, I talk about having lived experience, but it's really an honor for me to kind of be able to share a little bit about this more publicly. And I think I'm very proud of my journey.
Yeah, because you have worked with people from all over the world, like you said, refugees, immigrants, survivors of intimate partner violence, survivors of human trafficking, and then you yourself experienced, I guess, the formal diagnosis, at least. Maybe it wasn't the onset. Maybe you've been experiencing it for a while, but you received a formal diagnosis of OCD 5 years ago. So
exactly. Yeah.
How can you kind of walk us through that path of how you got to that diagnosis?
Yeah, absolutely. So, it starts from a young age of just, I've been a dancer my whole entire life. And that's kind of where the dance movement therapy part comes in. You know, I've always used dance as healing. So even as a young child, to deal with my own stressors, I tended to be a pretty anxious child and very perfectionistic. And now being an OCD specialist, I have an understanding of a lot of what was on the outside seeming perfectionistic behaviors was actually OCD manifesting itself internally. Yep. So from a very young age, I had a lot of concern around harming others, so specifically offending. Did I offend someone? Could I have potentially harmed someone because of my behavior? So there was a lot of mental review and checking, whether that was rechecking emails that I received to deal with, potential conflict that may have arisen. I actually kind of call it right now social justice OCD. I think a lot of the issues that I was dealing with from a young age, being an activist myself, as you had mentioned, I have worked with a lot of refugee populations, a lot of marginalized populations that were dealing with extreme persecution. And I think being someone not from that community, I experienced a lot of self-judgment that I didn't have the right to be working alongside these communities. And I think there was a great sense of I could potentially be harming them or doing something wrong, in just working with these populations, even though that's where my training had lied. And also, my clients always appreciated it and loved me, but there was still that doubt, that, pervasive doubt that comes along with OCD in my work.
Yeah, absolutely. Can you tell me about working with refugees? What refugees were you working with, and were you in a different country working with them?
Yeah, so I actually started in the United States working with refugees from Iraq, Afghanistan, Burma, Burundi. I started this work in 2014, so at that time, there were most of the refugees were coming from Iraq and just from the remnants of the wars in Iraq and Afghanistan. So I also worked with a lot of Bosnian refugees as well. And I had actually spent quite a bit of time in Bosnia-Herzegovina before I was a therapist. I was doing actually projects that were working on using dance as a tool for reconciliation. So that was kind of where I really understood that I could use dance for healing, not only for myself, but for others. And I understood pretty quickly that, in using movement and dance, there were also risks. Like, it could be potentially triggering for people if, they had undergone trauma and we did something that didn't feel right in their body. And that really propelled me to get clinical training and to become a therapist so I could, have those skills to be able to work with people who experience trauma.
Yeah, so I want to talk about that because I read a book last year called The Body Keeps the Score, which is all about trauma, and it helped me understand that just how trauma can manifest itself in the body, and then how dance and movement can be a great way for people to actually tap into those areas in their body where they might feel discomfort and eventually begin to change their relationship with those areas in the body and begin to heal. When you were working with like the Bosnian population, folks from Iraq and Iran, I guess, I mean, I can imagine, but I don't want to assume, what was some of the trauma that you were seeing, and what, I guess, let's start there. Like, what was the trauma that you were seeing?
So it was really a range. I think I had some of the participants I worked with, we call them participants at the agency where I worked, and a lot had experienced torture, especially those from Iraq. The Bosnian, especially the women, had experienced a lot of sexual violence. And also among the Burmese community, it was mostly ethnic persecution. That's the same for Bosnia as well. Most of the Bosnians that were seeing were Bosniak, who were Muslims, so they were kind of one of the most persecuted in that war. There's a lot of persecution on all sides in Bosnia, but they in particular were kind of the people that I was seeing. So there was a lot in terms of, trauma shows up differently in everyone's body. Everyone processes it differently, but the one thing that I would notice, like especially with the Bosnians that I worked with, was just a lot of disconnection and feeling like their body parts weren't attached. Like they kind of just felt like, they might just feel their torso. They might not feel like their arms or their legs are connected to their body. So a lot of our work was, how can we, make contact with our body in a way that feels safe or relatively safe, so that we can continue to move throughout our lives in this new country.
Yeah. How did you help them reconnect with those body parts? Because in the book that I read, it's definitely a process, and I just have a deeper understanding of trauma in terms of obviously the impact that it has on the individual in feeling safe. Like it's like the individual is always in some sort of fight, flight, or freeze response, and then trying to reconnect them. So what is the process of doing that with dance?
Yeah, absolutely. So, and again, like it can look different for everyone, and it's a very slow process, because sometimes even just naming a body part, or even just, bringing attention, asking someone to bring attention to their spine or to their feet sometimes can be overwhelming. So we have to just take it very slowly. And sometimes we need to rely on, orienting in our space first, like in our external environment, before we can actually go to a more internal place. So feeling a bit more comfortable with, okay, how can I experience the senses like we would in a grounding practice where we're connecting to our sense of sight and smell and the tactile sensation that we can feel. And that can be an inroad sometimes to dealing with the internal. So a lot of times what we would do, and this process is called resourcing, where we're finding, whether it's an image or a memory, it could be a person or food, that brings a sense of feeling settled and calm. And so we ask that person to imagine that. What does that look like? What does it feel like in your body when you imagine this image? And I have a very vivid memory from one of my clients from a long time ago of the image of a mountain. He said, like that the mountains in Bosnia actually were just so strong and powerful. Although it was also a source of trauma. A lot of in Bosnia, the snipers were in the mountains. So it was kind of both a resourcing image, but also an image that came with a lot of trauma. So our work together was, how can we reshape and reclaim the mountains as a bodied resource? So we literally worked on, okay, how do we feel that strength of the mountain in our legs and in our upper body and in our arms? How can we connect in our way? And I know listeners can't see me, but it's like I'm spreading my arms out and, really embodying this mountain. And it's like I have a very visceral experience, even as I'm explaining it right now and remembering that, because it's my body memory now as well, and just being within relationship in that way with my clients when we're dealing with movement.
Yeah. Did you, and I think I really like that. Just the reframing, it feels like that's a process that would take time. And
yes,
I have to imagine there were people that were also resistant, like, for example, with the example you used, the mountains in Bosnia, both being a place of comfort and sadness because of the snipers. Did you see a lot of people who were resistant to, like, picturing something of comfort because it would bring back those memories?
Yeah, absolutely. I think it can be a very sad process for many people. And once they're, and I've experienced, I did a lot of group work, and I would experience this in groups where it may have been 10 years since someone had experienced joy and laughter. And we would experience that in the group, and then they would start to break down crying because they hadn't experienced that emotion in such a long time. But this was a new memory that they created within the group context. So again, it's like that reframing and reclaiming of an emotion that we want to continue to nurture and bring in to the body. But it can take a long time. I think a lot of people will say, well, there's nothing can make me feel settled right now. So sometimes I offer suggestions, and I throw things out. I'm like, what was your favorite food? What did your grandma make for you? And even bringing in more, practices from the communities that they're from. It's like, who are the healers within your community? What would they do in a situation like this? Like, would they offer you something? What would they do to comfort you?
Yeah, I feel like that would be really helpful, because it's all about reteaching the person that they can feel safe again, because that is sort of, at least the way that I understand it, trauma in a nutshell, which is just like people feel dysregulated, everything feels unsafe and unsettled due to that trauma. How does the intersection of trauma and OCD factor into things?
Yes, it's a wonderful, wonderful question. And it's like, I feel like we have to, tread very lightly when we're working with people that have experienced trauma and OCD. We know, the gold standard for OCD is ERP, exposure and response prevention. But when we're working with trauma personally, I feel in my experience that we still need to do some resourcing before we would even move into the OCD work, because I think a lot of people with trauma, they just don't know what a settled nervous system feels like. So we have to, be able to get them to a place. And I know it's like we don't want to use that resourcing or grounding as an anxiety reduction strategy. We know that that's not going to be helpful in OCD treatment to rely on that. However, I think for people that haven't experienced what it's like to be settled in such a long time, we do need to work at first on what does that even feel like in your body? Like you need to know when your anxiety is going down or when you're starting to, experience settling in the nervous system. But, we know like with trauma and OCD, it really is, kind of attacking similar part of the brain, like the amygdala is firing off, right? That there's a danger here. I've got to pay attention to something. This is important. And that, that happens with trauma in whether it's experiencing symptom like a flashback or a nightmare, or the physiological response that comes up in the body, or if it's more OCD fear as well, like that can still feel that sense of hypervigilance can still be there with OCD as well.
Yeah, so let's talk about that real quickly. What are the different types of trauma? Because obviously being a refugee and some of the more well-known, like a lot of people will listen to this podcast and go, okay, well, I'm not a refugee. I'm not a survival of sexual assault. Some people will relate to that, but some people won't. I'm not the survivor of some sort of intimate partner violence. What are other forms of trauma that can impact people?
Yeah, absolutely. Well, I think there's, the collective trauma that we've gone through with the pandemic, right? We know that was really collective trauma for our whole society. There's trauma can be an accident, right? That happens. It can be a very unexpected loss of a family member or friend that maybe died in a traumatic way or not. That can still be very, very much a part of trauma. It can be bullying, and that happens to adults as well. Adults can be bullied. It can happen in workplaces. And I think workplace trauma is something that we're just starting to talk about more and more, and, toxicity at the workplace. And so I think those are things that I think as Americans we experience. Try to think of what else. Well, I just want to say like human trafficking actually does very much happen in the United States as well. We often think that it's something,
absolutely,
in another country, but it is actually quite prevalent in the U.S. among American-born citizens. It's something that's not always is more awareness for sure over the past few years. But.
Yeah, absolutely. Ones that come to mind for me, like divorce.
Yeah.
Could be traumatizing.
Yeah, absolutely.
Some sort of a breakup, right? Would that be categorized?
Yep.
Maybe a parent who was uncertain as a kid. You came home and you weren't sure how mom or dad was going to react or speak to you, or whether they were going to be calm and loving or explosive and angry. I picked that one up in the book. So that's another one I would say for listeners.
Yeah.
I'm just trying to think of more, because obviously like human trafficking and partner violence, they're all prevalent and a part of the trauma continuum. But just trying to cover as many bases as possible.
Yeah, totally. I'm trying to think of other,
and maybe
Anything
we have,
can be a trauma. It's
yeah,
very subjective, and I think often, I think anything can be traumatic. There tend to be certain patterns of things that come up, but
yeah.
you know
What about
people can.
feeling settled? Feeling settled in the body. What
Mm,
does that feel like? What is it? What is a
mm,
settled nervous system feel like for people listening?
yeah, that's such a great question. Um, and I can, if you're open to it, I can lead us in a little experiential, if you like,
Yeah.
to kind of
Yeah.
what is that like? And as I'm
Why
doing this,
not?
I also want to, I think that's the best way. It's like we need to find that out for ourselves because it's going to feel different for everyone. Um,
Mm, mm.
and in doing this, like you can choose to just listen. You don't have to participate. You can just
Okay.
be like an
Well,
observer. As you're, like speaking,
I'm going to
to all the
participate
listeners
and
here,
hopefully the
that
listeners
it's
want to.
yeah, and it's and just knowing that also whenever we do bring attention to the body, we can have surprises. Surprises can come up. So just being
Okay.
mindful of where you are right now, and just in your emotional state, where you are as you're listening, if you're able to do this. If you're driving, maybe you might want to pull over just to be able to focus. And at any point, you can take a step away. You also don't have to continue with it, but I invite you to try it if you want. So taking a moment, so wherever you are in your day right now, as you're listening to this, and you can keep your eyes open. You absolutely don't have to have eyes closed right now.
Can I close them if I want to?
You can. You
I'm going to
can.
do this
Yes, you can.
experience. So I'm going to go through this. I'm
Okay.
curious. All right, I'm going to
Okay.
close my
Yeah,
eyes.
totally. Yeah. If you feel like you can absolutely close your eyes. You can also kind of soften your gaze a little bit as well as if we were doing a mindfulness practice. And we're just going to take this minute, and you may have done some of the 3-minute breathing space practices, and we're just going to start in that way as we would with kind of a mindfulness practice of just observing what's here right now for us. We don't have to dive in to any of the thoughts, feelings, or sensations. We're really just observing what's here right now, saying a gentle hello to what's here. And if it is accessible to you right now, I do invite you to start to think about an image or a person, your favorite food, as I mentioned, perhaps color even. Bring that into your mind. And just start to notice, how do you breathe when you bring that image into your awareness? Is there a shift in posture? How are you sitting right now? Is there any movement even that you would like to do, or a gesture that would further represent this image? And I invite you to do that. If there is something that does come up, feel free to do a gentle movement or a gesture. Or you can just sit there with that image in your awareness right now. You may gently check in again with your breath or your heart. I invite you even just to maybe find 1 or 2 words you can say to yourself that just also represents this moment and this image right now for you. It's almost as if we're taking this snapshot, this moment in time that we can come back to if we need to access it again in the future. Noticing, is there a place in our body where we are really feeling this image in this moment, a place that we can store it for later. When we're ready, we're going to gently thank our bodies and our minds for inviting this into our space, and gently open your eyes. If they are closed, you can start to reconnect to your environment. When you're ready, you might even take one of those nice morning stretches too that we do, like especially if you have an animal. You might, if you have a dog or a cat, like they always stretch before they do any movement. Yeah. So just do one of those nice morning stretches that we tend to forget to do. We often pop out of bed and we don't take a few moments just to stretch. Yeah, so that's something I would often invite people into, to begin to see, okay, what happens? And you may not reach a fully settled nervous system, right, in those few minutes that we had there. It could be a longer exploration, but I'm curious of what you noticed even just in doing that.
Yeah, I mean,
practice right now.
Yeah, so I meditate every single day for 15 minutes in the morning, and then I try to meditate again at night. But I'll tell you that when I first closed my eyes, I felt that I really had like a pounding heart, which it's weird, because it was interesting to me because I don't feel anxious or nervous about this podcast interview at all. It's, for me, it seems like there's sort of my default mode is operating. That's why I'm so curious, is from that place of hypervigilance, more of that tendency to be anxious with the heart pounding, and then when I go through an exercise like that, I feel calm again. And this is the same type of calm that I feel after doing a meditation. There have been times where I've achieved this level of calm just naturally, like laying around and relaxing. But I will tell you that in my journey, and I always tell people on this podcast, I'm very transparent with this, I still feel like I'm unpacking a lot of my own traumas and my own experience, and teaching my brain and my body that I'm safe and I can let go. Yeah. And so for me, it was a really cool exercise, because it does remind me that like I can tap into that calmer version of myself through exercises like this. And I like that. But at first I was very aware of like the heart pounding and even like a little tension in the jaw. And headaches. I get headaches a lot. And I feel that is due to being hypervigilant and feeling like I have to be focused and aware. And I can't just let go. That the way that I have to go through life is, the way that I keep myself safe is by doing. So I'm aware of that. And I like having these conversations on the podcast and talking through it, because I think that for other people with OCD, I do think with a lot of people that I speak to, they have experienced some sort of trauma, something that's happened to them, or multiple traumas, and they didn't know that they were traumas. And so, you know what I mean? So they just kind of trudge through life. But yeah, for me, I feel more calm, and I appreciate you walking me through that. But I noticed, when I first closed my eyes, I was like, oh, wow, I have a little bit of a headache. I have tension in my jaw. My heart is beating a little bit faster than normal or than I would like.
And it's, really good awareness, because I think sometimes we assume that settled has to be relaxed or settled has to be stillness. And that's not necessarily always the case. Like, we can be settled in doing too. So it's noticing of like, how do we move through our spaces, and times like, our nervous system is going to be activated. We need to get into that, the sympathetic part of the nervous system that is, activating at times and helps us do what we need to do. And I think also, for trauma survivors, just that state of relaxed or even inviting into relaxation can be very scary, because and we don't often use that language. We'll say, like, we're, and I think that's why I'm always using settled versus regulation. It can just be a more friendly term, I think.
I like settled.
Sometimes of like settled, and so a lot of times, like, I'll do, in this exploration, I'll even invite people, like, of really exploring, okay, where does my body feel strong right now? It's like, how can I feel? And we might even do like wall push-ups, or, kind of really feeling like the strong muscles of our quadriceps, our thigh muscles, of like, okay, where in our body do we feel strong, like in these actual muscle groups that promote strength, as an inroad to accessing a settled nervous system as well. Because going into relaxation, it can be too much. It can be too scary. People might not be ready for that.
How did you discover, I guess, that you had OCD, and was trauma an aspect of that? And how do you, if yes, how have you navigated that?
Yeah, good question. So I experienced a lot of loss as a young child. I had lost my father at the age of 12, and soon after my grandmother a few months later. So a lot of childhood loss. And I do think a lot of the OCD, a lot of the obsessions, the compulsions kind of developed at that time. And I think it was, that the fear of losing someone contributed to my fear of causing harm, doing something that, would potentially harm someone. So I think, and I, like I said, I didn't know until 5 years later. And it was really a point in my life where I was working in community mental health, and an extremely stressful job, not because of the clients, but because of the administration. But, and this is where I'm talking about like toxic workplaces. And that was really fueling my OCD, because I was experiencing a lot of shaming from administration. And I just really internalized it, and it just exacerbated my fear of causing harm, both to my clients or to my friends. And I was just very, very hyper vigilant around, like, I was really in this state, like I could not access a settled nervous system at that time. And then the OCD was just feeding on that. And I was so lucky to have a provider. I mean, even as a mental health professional, I did not recognize that in myself. And, as there's, still a lot of mental health professionals don't really know about OCD or how to recognize it, even though there is more awareness now. But, I was really lucky to have found someone that recognized it in me. So I went through ERP. I had a great ERP therapist and went through treatment. And that's really led to my passion today to work with other people with OCD.
Yeah. So I understand the ERP part, but I'm really curious about the trauma side of things. What is that? How did that trauma manifest in your body? Not feeling settled.
In my body, yeah.
What did that feel like? I'm curious.
Yeah. So So from a sensation perspective, so looking at like body sensations, I think it was, it's very, I mean, for me, it was hard to distinguish between the emotion of rage that was kind of connected to the trauma that I would feel in my body. So it just, I felt so tense. Like I just, my back was always hurting. My breath was shallow. That was a big indicator for me. Even as a dancer, like I was having a hard time catching my breath. I just, I couldn't sleep. I had a really hard time sleeping. And it's like my body, it felt like I wanted to enter into a room, like a padded room, and just throw myself up against the wall. Like that's what my body wanted to do. It was so intense. So that was definitely, I think both the trauma part of my body just not knowing how to process all of this, and then the obsessions coming in, which just fed into compulsions that would take a long time of constantly ruminating and thinking about what did I do wrong,
right?
How could I prevented the situation?
I mean, I resonate with a lot of those symptoms. I feel like sometimes the tension builds up in my body, and like the thought that comes to my mind is like I could just like scream to like let it out.
Yeah.
Like some sort of release of it,
Exactly, yeah. And for me, it was like, and I actually created a dance performance basically about this. It was really about the secondary trauma. The first performance, I didn't know about OCD at that time, but it was really involved like bouncing on a bed. It's like I kind of achieved that on this. And then the second performance was one of those big plastic balls that you use for soccer. And if you've seen those where you kind of bounce and you kind of hit into each other, you have to Google it. But I was like, this is what I need. This is what my body needs right now. So I kind of used that creative energy to really attend to what my body needed at that time. While also being aware, I think, and it's like I want to just, make clear too that, I know with OCD treatment, it's like we want to be careful of not to go into too much of a coping skill. But there's also times when our bodies just really need to do something that we can't sit with things sometimes. Sometimes our bodies really need to move through something. And I think that's, especially when trauma, it's like we have to have that release. We have to have that, I think it's called like an act of triumph in some trauma language of where you're able to kind of fully finish the movement that your body wants to do to be able to process the trauma.
So how have you processed your trauma?
I mean, I think it's ongoing. It's ongoing. I think
Definitely.
It's within, I think being in collective spaces with other dancers and dance movement therapists that have gone through similar things. Like I feel like with trauma, healing really needs to happen within the community. So I know for myself, it doesn't necessarily need to be in a clinical situation. It may be in a dance class together or something where we're creating. And I think that has been such a part of my processing. Like I said, I created a full hour-length production where I got a grant to put this on. And that was such a huge moment of being able to process my trauma and display it to the world as well. And to, put this performance on display and to have other people impacted and witnessed. I think it's that act of witnessing is so important for trauma when you're able to get to that place of being able to be witnessed.
Absolutely. I think that's really interesting. Is there anything that you do on a daily basis to help process through things, or what does that look like?
Yeah, I like to keep it pretty simple. So I've got a beanbag chair that I just love. Like anything that can hold me.
Yeah.
Of just like, and taking a moment of stillness for me. Although I like to move, I do appreciate moments of stillness, and I think, and like I said, that there can be movement in stillness. We don't have to be sitting completely still and rigid. So I think like kind of either being in a hammock, like taking a moment, being in my hammock or my beanbag chair, or just lying on the floor. Even after a long day of working with other people, I usually take a few moments, lie on the floor, connect with my body, check in, what's here right now, to kind of prevent that buildup. Because I know if I don't do that, it will build up, and it'll be harder, not impossible, but harder to deal with it and address it.
Okay. I think that's helpful. I like the exercise that we did earlier. I feel like checking into the body, checking in with the body was really helpful. Well, we're coming up here on the 45 minutes, so I want to be respectful of your time. Do you have any advice for anybody in the OCD community that's interested in maybe exploring any traumas that are contributing to the OCD factors? Anything that you would recommend people do to start on that healing journey?
Yeah, so I know that there's a lot of different schools of thought. I know that the OCD community often would recommend prolonged exposure therapy for trauma. However, I know people from my OCD community would kill me if I said I don't like prolonged exposure. Although I'm the biggest fan of ERP, right? I do ERP all day for OCD. But for trauma, I think if you are able to find, and this is hard to find someone that has that connection, that has that awareness of the body, that has body-based practice, they don't necessarily have to be a dance movement therapist. They may have experience in sensory motor psychotherapy or somatic experiencing. Those are some other body-based practices, to at least begin to notice and understand like what that settled nervous system feels like, I think, before going into ERP work. Although at the same time, with a good ERP therapist, you can also achieve that too. I think because it's like every time we make contact with the body, that can be an exposure as well, right? Because it can be scary. It's like we're paying attention to these things that we're often ignoring and avoiding. So I think it's, if you're able to find a good ERP therapist, or even if you're trying this journey on your own, knowing that, and just bringing awareness to the body as you're starting to do exposures, or even as you're starting to create a hierarchy, it can be both grounding, but also you're learning to tolerate discomfort as it arises in the body at the same time.
I think that there's something to be said about learning how to tolerate discomfort too. And
and I think it's like we often focus on the comfort part in trauma, but we have to focus on the discomfort too. It's like it's such a big part. I know I emphasize the other side, but we do, right? We absolutely need to be able to tolerate. That's how we broaden our window of tolerance, to be able, because we know that's just going to come up. It's going to come up all the time. So it's equally as important.
Absolutely. Well, I absolutely appreciate you coming on and sharing a little bit about your journey and experience, and sharing a little bit about the trauma side of things too, because I feel like that's a underrepresented side. And just want to thank you for your time.
Yeah, thanks for having me on.
Absolutely, Ashley.